Our project is going to be focused on type 2 diabetes prevention through diet. In our video, we are going to analyze the effect of a whole grain diet on the possibility of preventing type 2 diabetes. After that, we are going to transition into the effect of red meat versus a vegetarian diet on the possibility of developing type 2 diabetes. We will then discuss how fat intake has an effect on it as well, and finish off with analyzing a study by Cambridge of the prevention of type 2 diabetes.
There are two types of diabetes. Type 1 is where the pancreas does not produce enough insulin for any glucose to enter the cell. This is often regarded as unpreventable and shows up very early in life. Type 2 diabetes is where the body cannot use the insulin that is synthesized by the pancreas. This is largely related to the diet and develops much later in life. There is also a very rare genetic mutation that can be passed down to a carrier's child. This is called maturity onset diabetes of the young. The way it functions is essentially the same as type 2 diabetes, except it forms very early in life and is not related to the diet at all. Some common risk factors that can increase your chance of developing type 2 diabetes include age, where onset can be seen after the age of 35, but it typically doesn't develop until you're 45 or older. If you have any family history with type 2 diabetes, if you are overweight, if you have a strong lack of physical activity, or if you develop insulin resistance.
Prediabetes is a diagnosis that is given to individuals with a blood glucose level that is higher than normal but not high enough to be diagnosed with diabetes. People with prediabetes have up to 50% of a chance of developing diabetes in the following 5 to 10 years. People diagnosed with prediabetes can prevent the development of type 2 diabetes through lifestyle and diet changes. Testing for prediabetes can be done with tests looking at levels of A1C. The A1C percentage measures how much sugar is attached to the blood's hemoglobin protein, and the value is indicative of the past 3 months. There are 2 other tests that are called the FBG, which is the fasting blood glucose, which measures the blood sugar levels after fasting for 8 hours, and the OGTT, which stands for the oral glucose tolerance test, which measures the body's response to glucose. Those who are overweight, obese, have 1 or more risk factors for diabetes, or have a family history of type 2 diabetes should be tested for prediabetes. The image on the right shows the data for the 3 tests and includes the normal, prediabetes, and diabetes type 2 levels for the A1C, the fasting blood sugar test, and the glucose tolerance test. Type 2 diabetes is a chronic disease. A chronic disease refers to a condition that lasts 1 year or more and requires ongoing medical attention and/or limiting to daily activity. Roughly 1 in 10 Americans will get diagnosed with diabetes. As you can see from observing these maps, obesity and diagnosis of diabetes are closely related, with areas of high obesity also having high diabetes diagnoses. Obesity is most commonly the result of poor diet and lifestyle choices. Diabetes is known to be more prevalent in the South. This makes sense due to social and cultural factors. Southern diets usually contain more fried and fatty foods than other places in the U.S. Looking at this map, we can see that states such as West Virginia, Tennessee, Mississippi, Louisiana, Alabama, and South Carolina have the highest incidence of diabetes. Diets high or consisting only of fruits and vegetables can reduce your risk of type 2 diabetes. Compared to a typical American diet, vegetarian and plant-based diets are higher in fiber. As said before, fiber reduces cholesterol by binding to it and disabling it from entering the bloodstream. Additionally, meats contain saturated fats. Saturated fats contributes to lipotoxicity, which is when toxic fats metabolites accumulate in muscle cells, which impairs insulin signaling and decreases glucose uptake. Fruits and vegetables with a low glycemic index are best for regulation and prevention of type 2 diabetes. For fruits, these include cherries, apples, oranges, strawberries, and more. For vegetables, lettuce, carrots, yams, kale, broccoli, and more are low in glycemic index. A plant-based diet has been shown to reduce visceral fat more than a conventional diet in individuals with type 2 diabetes. High amounts of visceral fat are known to be associated with insulin resistance, which can lead to glucose intolerance and type 2 diabetes. One dietary factor that has been found to reduce development of type 2 diabetes is a diet high in whole grain. According to a study published in the Journal of Nutrition, researchers found that the highest whole grain diet intake among men was associated with a 34% decreased risk of type 2 diabetes, and women who ate the most whole grains saw a 22% decreased risk. In addition to fiber, whole grains have nutrients such as proteins, B vitamins, antioxidants, and trace minerals like iron, zinc, copper, and magnesium. Ultimately, diet is an effective way to prevent and regulate type 2 diabetes risk. When meal planning in regards to diabetes, different methods can be used. One method is using MyPlate. The CDC recommends using this method to visualize what you are eating. This method calls for filling a 9-inch plate with half non-starchy vegetables, which can include salad, green beans, broccoli, cauliflower, cabbage, and carrots. 1/4 of the plate should contain lean protein, which includes chicken, turkey, beans, tofu, or eggs. 1/4 should contain carb foods. Foods that are high in carbs include grains, starchy vegetables such as potatoes and peas, rice, pasta, beans, fruit, and yogurt. A cup of milk also counts as a carb food. Add water or a low-calorie drink.
Next up, I'm going to talk a little bit about red meat and fat's contribution to the development of type 2 diabetes. The typical Western diet contains high amounts of desserts or sweets, processed meat, red meat, and high-fat dairy products, all of which are known to help increase your chance of developing type 2. According to a study from the American Diabetes Association, high-fat diets help promote obesity and can also promote insulin resistance, which is when insulin becomes less effective at taking glucose into the cells, and the glucose that doesn't get taken in gets stored as fat. Another ADA study shows that high red meat intake is also associated with increased diabetes risk. This is especially true when it is also paired with high amounts of processed meat. During the cooking process, nitrates, heterocyclic amines, and polycyclic aromatic hydrocarbons can convert to N-nitrous amines. These are toxic to pancreatic beta cells. The beta cells are the insulin-producing cells in the pancreas. The study also found that end products of lipoxidation and glycation produced during the cooking process can also promote insulin resistance. Switching gears a little bit, Cambridge University did a study where they say the overall objective of the study was to evaluate and provide evidence and recommendations on current published literature about diet and lifestyle in the prevention of type 2 diabetes. The recommendations are as follows. The first guideline deals with weight gain. They say, prevent childhood obesity, especially those in higher risk, avoid excessive adult weight gain, and to keep BMI between 18.5 and 24.9. The next recommendation says to have at least 1 hour of physical activity for most days of the week. This is a good habit to get into, as vigorous physical activity is required to lower the risk. The third recommendation deals with fat intake, saying that saturated fat intake should not exceed 7% of total energy intake, and total fat intake overall should not exceed 30% of energy intake. The fourth guideline says that non-starch polysaccharide intake should be about 25 grams per day. These can be found in whole grain cereals, legumes, vegetables, and fruits. So lastly, just a quick summary of some recommendations that can help lower your risk of developing type 2 diabetes include lowering your glycemic index. This is achieved by eating mostly green vegetables, most fruits, raw carrots, and chickpeas. They're all low in glycemic index, so filling your diet up with stuff like that will help prevent it from getting high. And some things to avoid would be white rice, white bread, or like starchy potatoes. Another guideline is to fill your diet with lots of whole grains. These are also low on the glycemic index scale, and they also have high fiber content, which is helpful in reducing cholesterol. And like I mentioned before, lots of fruits and vegetables. Most fruits and most vegetables have low glycemic index, and they can also help reduce visceral fat and insulin resistance. Another is avoid excess fat intake. Trans fats heighten LDL cholesterol content, So you definitely want to stay away from that and just excess fat intake overall. And if you're at risk, avoid eating too much red or processed meats, as this is known to heighten your chance of developing type 2 diabetes. And lastly, live a healthy lifestyle. This is really important because it helps lower your LDL cholesterol and it helps prevent obesity. It's truly one of the best habits to have when trying to prevent developing type 2 diabetes.